Good afternoon, everyone. So today we're going to talk about 988, which is the new number in play. Okay, so let me say it correctly. So 988 is the new mental health number. If you are having an active mental health crisis, instead of 911, you will be calling 988, right? And this goes into effect in July 2022. So I just want to provide more information so you will know what to expect. And more importantly, is your state even ready to, for this, to roll out this new number? I have been reading a lot of information, and I've been reading a lot of states are not ready. So I just want to give you a little overview of what we're going to be talking about. I am your favorite therapist, Lily Duv. I'm here to talk all things mental health. So you never know what the content might be about. So you have to tune in every single time so you'll know exactly what we will be talking about. I'm playing the music right now, but I did get a message saying that my music is kind of drowning me out. So I'm gonna give it about 5 minutes for everyone to get in. During that time, I will play the music until I get back, but I will get started in about 5 minutes. All right, talk to you in a minute. Okay, I'm back. So, just trying to let some people get in just in case someone wanted to catch it live. But okay, you can always catch the show out there. It's I have played it. um, the only difference is if you were here, I could answer any questions you have. But hey, life is not perfect, so we go with what we have. All right. So before we get started, I'm going to put my website up here. As everyone probably knows by now, I am a therapist. This is our company, DuvalierConsultingServices.com. Um, we do offer free 30-minute consultations if if you're needing more skills to deal with life stressors, and we all know there's a lot of stressors uh, in today's world. Okay, so we're gonna have a twofold. So we're gonna continue to pray, right? But we're also gonna learn some more skills that we can use on a daily basis to also incorporate, with our daily living. So if you need any more assistance on that, just reach out to me, DuvalierConsultingServices.com, and someone will be glad to assist you. All right, so let's get started. So, as you see today, like I was stating earlier, you never know what topic that I will come with, but it will always be all things mental health. I'm here to advocate for mental health. I am, like I said, a therapist, and I do believe it's a huge stigma on mental health. Maybe because of the name, I'm not sure, but I'm here to help break the stigma and let people know that it's okay if you're not 100% yourself. If you're not feeling 100% yourself, it's okay. That doesn't make you less of a person, right? And the thing I think people get um um confused with with going to see a therapist is that I think they feel that it has to be for someone who's, I guess, as we would say in my community, is going crazy or went crazy or losing their mind. No, it's nothing like that, because basically if you were and I hate to use that word, if you were experiencing a severe mental health crisis, you would be basically need to go to a hospital anyway for stabilization, right? Because therapy wouldn't really help you at that moment. But once you were released, right, and you were stabilized, then at that time you could begin seeing a therapist. Or so this is basically for just to learn some more skills to go along with what you already have, to just, be able to deal with everyday stressors that may come, that might come about. So you won't have to feel that overwhelming feeling. Or for example, if you have finally faced, and I'm not talking to anyone in particular, right? I'm just speaking in general. If you're starting to see that you're thinking in a negative way, therapy would be for you, because let me say it like this: thinking in a negative way and wanting to change, you know, that negative thinking. Now, therapy would be for you. So you still working, you still going to work. You're not like in severe mental health crisis. You just want to find new ways, to to help improve your mood, right? So those are reasons you could see a therapist as well. So I think that would be the first part of the conversation, just breaking down exactly why do you go see a therapist. Because I think it's a misconception that a lot of people think that you only go see a therapist when you are just, in dire needs. But no, that's not the case. You can see them just even if you feel fine. It's just skills to add on to the ones you already have. For example, I know I offer parent management training, right? So we offer that, and basically what I tell my parents, because of course no one wants to be told that they don't know how to parent their kids, right? And 90 and most people know how to do that. But the thing about it, if you're trying to be the best version of a parent to your child, right? So you already have the skills and you're trying your best, but what would it hurt to learn additional skills, especially if your child is dealing with behavior issues such as ADHD, conduct disorder, oppositional defiant disorder. So those type of situations you would well, not situation, but those type of diagnoses, you could definitely benefit from parent management training. So it's not to criticize your parenting skills. It's basically to add on to what you already have. Make sense? Okay, so that has nothing to do with what I'm going to talk about today, but I just felt I needed to say that. So let's get started. So, like I said, today we will talk about 988. And let me see where I want to get started. Let's start right here. Let me see. Okay, so start right here. Let me share my screen. And okay, hold on. Let me share my screen. All right, share. Let me make it bigger because I got. And today I had a video to play that was included, a YouTube video that was included, but you get dinged yesterday for playing. So I probably won't any videos, but you may be able to go back and watch it if you would like. But I won't be playing any. Uh, so let me close this. Hopefully they'll let me show it. Uh-oh, y'all. They're not gonna let me. This I did up too many times, but it's okay. We'll go to the next one. Let's go to this one. So, am I sharing my screen? No. Okay. And give it a second. It's taking a while to come up. So, how's everyone doing today? I know most people are going to catch this after the fact. So, how are you doing now? You can always leave a message right now as well. I'll still read it. Okay, so let's get started. Um, Let me share my screen. What did I say? This one. Okay. So first, we're just gonna. This is from the Substance Abuse and Mental Health Services Administration. And this is just going to go over some frequently asked questions about the 988 Suicide and Crisis Lifeline. So it says preparing for full 988 implementation requires a bold vision for a crisis care system that provides direct, life saving services to all in need. This leads to many questions about the transition to 988 and how will it work. So let's just answer some questions. SAMH SAMHSA.gov was so kind to provide us some frequently asked questions. So the first one we're going to go through is what exactly is 988, right? I know a lot of people may have not heard of this, but once you find out more information about this, I did talk about it yesterday on my live if you were able to catch it. But once you hear more about it, you're going to see how important this number is if you don't know much about it as of yet. So it says 988 beginning July the 16th. 2022. So we have about a month and 8 days. 988 will be the new 3-digit dialing code connecting people to the existing National Suicide Prevention Lifeline, where compassionate, accessible care and support is available for anyone experiencing mental health related distress, whether that is, oh, trigger warning. I will mention the word suicide. I won't be talking about suicide, but the word suicide will be mentioned in this live. Trigger warning. The word suicide will be mentioned in this live. I just want to let you know. Okay, so it says, so It says, beginning July 16, 2022, 988 will be the new 3-digit code. So I read that already. And then this will be for anyone experiencing mental health related distress, whether that is thoughts of suicide, mental health, or substance use crisis, or any other kind of emotional distress. People can also dial 988 if they are worried about a loved one who may need crisis support. So before I go any further, we all have seen videos where the police were called out. A person was in mental health distress, as we can call it. And of course, the police are not all the times trained for this type of situation, and the person ends up dead. Right? It has happened uh, lots of times. So now you begin to see exactly how important this new number is. So beginning July 2022, we got a little over a month. This number, you no longer call 911, because at first, that was the only number we could call, whether we were experiencing we were a victim to a crime, whether we knew whether we someone was having thoughts of suicide, whether they were having mental health crisis, emotional distress, whether they were calling for their loved ones who were needing crisis support. Everything felt under 911, right? So now they have designated a number, and it's okay. I was going to say it's supposed to be in all states, but we'll get to that in a second. um so they have a designated number now for those that are experiencing these type of issues. So you no longer have to call 911 and risk, right? And uh risk someone coming out who just doesn't understand what mental health crisis looks like. Okay. So let's go to the next one. It says, when will 988 be available? The 988 dialing code will be available nationwide for call, and it says it's going to be in multiple languages, text or chat. But if you're texting, text or chat, text or chat. If you're texting a chat, just keep in mind it will only be English. And let me just I just want to make sure my screen is able to see. Let's see. Just a little bigger. So make sure making it accessible for everyone. I might make it a little bigger. Let's see. Excuse me. That should be good. All right. Okay. So it says text or chat, but it will only be in English only. But the number, the 988 number itself, will offer many languages. All right. And it's going to be available. It's supposed to be available for all states. Um, and this is gonna be under that plan that I was talking about yesterday. I won't go much into that. You can go catch the live that I did yesterday, but it falls under the American Rescue Plan. So it's gonna be available July 2022. Until then, those experiencing mental health related or suicidal crisis, or those looking to help a loved one through a crisis, they still have a number up here, which I never heard of this number, but that's good to have. So if you need it, please write it down. So that's if you're having a mental health related or suicidal crisis, you're helping a loved one through one, you still can call 1-800-273 8255. So that's still good too, because at least you're still not calling 911 and taking a chance that a police or law enforcement um, officer may come out and might not understand the situation. So it says, is 988 available for substance use crisis? The Lifeline accepts calls, texts, and chats from anyone who needs support for a suicidal, mental health, and or substance use crisis. So I guess the answer is yes. So it's going to be for suicide if you're having those suicidal thoughts, if you're having mental health issues, or substance use crisis. What do people who need help now do? So, like I mentioned earlier, right now they still have a lifeline number. It's 1-800 273-8255. And they also have this suicide prevention lifeline.org available. So the next one is, so it says, will the 1-800-273-8255 number go away when we switch to 988? Okay. So it says moving to 988 does not mean that the 1-800-273-8255 number goes away. After July 16, 2022, when the 988 number will come into effect, using either number will get people to the same services. In the end, 988 is an easier to remember way to assess a strengthened and expanded network of crisis call centers. And I agree with that, because just like everyone knows when you call the police 911, but I'm pretty sure that the police also has a what is that? 10-digit number, right? I'm pretty sure they do, but everyone just knows when you're experiencing, you know, when you're a victim of a crime, etc., etc., you're going to call 911. That's easy to remember and it's fast. So that's going to be the same thing with 988, even though the 1-800-273-8255 will still be available. 988 is just easier to remember, right? And then it's fast. You can just quickly call 988. So you might not remember the whole 1-800 number. That's 10 digits you have to remember. And I don't think these days we don't remember a lot of numbers. I think I just memorized my husband's number, like not too long ago. Because I just pushed the button, my husband, and that's it. Now, of course, I know my mom's number. She had the same number forever. I remember hers. But it's a lot of people's numbers. If you had your number for over, I'd say about 5 to 7 years, I probably know it by heart. But if it's a newer number, I don't know your number. So I'm just gonna let you know. And that's probably goes for most people. But I would remember 988, and I'm pretty sure a lot of people would remember 988, right? So it says, is it only for suicide related crisis, which we already went through that. It said that it will be available for those dealing with suicidal thoughts, mental health, so suicidal crisis, mental health, and or substance use. Okay, so this is a good one. What happens when I call 988? Starting July 2022, when calling 988, callers first hear a greeting message while their call is routed to the local Lifeline Network Crisis Center. And of course, it's going to be based on your area code. A trained crisis counselor will answer the phone, listen to the call, understand how their problem is affecting them, provide support, and share resources if needed. If the local crisis center is unable to take the call, the caller will be automatically routed to a national backup crisis center. The Lifeline provides live crisis center phone services in English and Spanish and uses solutions to provide translations in over 250 additional languages for people who call 988. All right. Making sure. All right. So let's finish. So it says what happens if you just decided to chat. So it says chat is available through the Lifeline website. You see the website up there if you wanted to chat. People seeking chat services will be provided a pre chat survey before connecting with a counselor that identifies the main area of concern. If there is a wait to chat with a crisis counselor, a wait time message will appear. And if demand is high, individuals can access the Lifeline's helpful resources while waiting, or call the 1-800 number or 988 after July 16th, 2022. Once connected, a crisis counselor will listen to you, work to understand how your problem is affecting you, provide support, and share resources that might be helpful. And it's going to be about the same thing when you text. Okay. Says, how is 988 different than 911? This is an important question. 988 was established to improve access to crisis services in a way that meets our country's growing suicide and mental health related crisis care needs. 988 will provide easier access to the Lifeline network and related crisis resources, which are distinct from the public safety purposes of 911, where the focus is on dispatching emergency medical services, fire, and police as needed. So, how will 988 and 911 complement one another? The 988 and 911 systems will need to be closely coordinated to seamlessly allow referral or callers for appropriate care or response that addresses the unique circumstances present with each crisis encounter. So it says SAMHSA, which is the website I'm on, is actively engaged with 911 counterparts at the federal, state, and local levels to plan for smooth coordination between the two services. If I call 911, will first responders like the police or EMS be automatically dispatched? Okay, so it says the primary goal of the Lifeline is to provide support for people in suicidal crisis or mental health related distress in the moments they need it and in a manner which is person centered. The vast majority of those seeking help from the Lifeline do not require any additional interventions at that moment. Currently, fewer than 2% of Lifeline calls require connection to emergency services. Um, like 911. So it's really no need to call 911 because they're just having a mental health crisis or suicidal crisis. So it's no need for 911 to show up because they have not committed a crime. They're just in crisis right now. While some safety and health issues may warrant a response from law enforcement and or EMS, emergency medical services, especially like when a suicide attempt is in progress. Of course, we would need to call EMS at that time. It's a suicide, if it's in progress. Um, the 988 coordinated intended to promote stabilization and care in the least restrictive. Basically, the crackers, they would come out, stabilize the situation. You receive counseling on the spot, and then be referred to resources in your community. Will 988 calls be referred to 911? In most states, the 211 system provides health and social service assistance information and referrals. At the same time, 988 crisis counselors will provide support for people in suicidal crisis or mental health related distress in the very moments they need it most. While generally being different in scope, these systems need to be aligned. And in many cases, local lifeline centers also respond to 211 contacts. We envision, because you got to realize this has not been released yet. So this is just, it's going to be released July 16, 2022. So they can only, envision what they want it to turn out like. So it says we envision that 988 crisis centers will need to continue to coordinate with 211 and other warm lines. This will help ensure an all inclusive approach, regardless of which number a person may use first. If I call 988, will a crisis counselor be trained on cultural competency? So basically, understanding like different training for lifeline counselors. There are several activity pages, websites, creating specific pillars such as Spanish language clinical guidance resources, deaf and hard of hearing best practice for callers or chats visitors, an LGBTQ plus guidance document, and American Indian Alaskan Native tip sheet, and more. How should I refer to this new number? It's important to understand that 988 will connect people to more than just a suicide line. It will be a service for anyone who is suicidal or experiencing mental health and or substance use related crisis. So it is going to be for those who may be experiencing suicidal thoughts, those who may be having a mental health crisis, and or substance use related crisis. You can call 988 number, which will be available July 16, 2022. Don't call now. I'm pretty sure if you call now, no one is going to answer. You have to wait till July the 16th, 2022 when it comes into effect. Okay, so let's see. So it says, where more should 988 be delivering beyond just a call, text, or chat? Having enough capacity to meet the growing demand for suicide and crisis care needs across the country is the primary focus of SAMHSA's 988 efforts. And like I mentioned earlier, this SAMHSA is the website I'm on, and you will have to go back to catch the beginning of the live to um see what that stands for. So it says this includes strengthening and expanding crisis call center services. It also means improving follow up and linkage to local in person crisis services as well as residential and outpatient care. So basically, don't think of this number as just somewhere, somebody, someplace to call where you're just going to have someone to talk to at that moment and say, okay, I need, basically you calling and saying, okay, I'm having this type of crisis. No, they're going to follow up with you. They're going to refer you to let's see, local resources around you. So maybe if you have not been on your medication, they're going to refer you for that. If you need therapeutic services, they're going to refer you to that. Maybe group counseling, maybe uh s- um if you're on having substance use issues, they're gonna refer you for that. So it's not 988 ain't 988 is not just a number where you will call and say, okay, can you talk me out of this? Okay, so that calls begins to wait for other resources that will be available for you. Okay. Um let's see. I'm not going to go through all of these because some of them I don't think we need. And you can always, if this is interesting to you, you do see the website up here. It's available to anyone, samhsa.gov, and then you're going to go to find help and then frequently ask questions if you wanted to take a look at all the information. I'm just going to go over what I think is important because I do have a lot of other information that I need to cover in this live. Okay, so it says this is an important one. Will 988 be available in all states and all five territories? Okay, here we go with the date again. Starting July 16, which is amazingly a week before my birthday. So I should definitely remember this. Starting July 16, 2022, anyone who needs suicide or mental health related crisis support or who has a loved one in crisis can connect with a trained counselor by calling. And like I said, they do have multiple languages, chatting or texting. And remember, just keep in mind if you're texting, it's going to be English only. So if you're requiring a different language, you probably are going to have to call the number. They don't offer what was that? It just went off. They don't offer different languages when you're chatting. I'm sorry, when you're testing. Okay. And it said this is another important one. Um, it will not accommodate those who are hard of hearing or blind. The Lifeline currently serves TTY users either through their preferred relay service or by dialing 711 and then the 1-800 number, 1-800-273-8255. So if you are deaf or hard of hearing, you're going to dial 711. And once you dial 711, you're going to dial 1-800-273-8255. Lifeline also offers services through um, chat and text. Lifeline is in the process of expanding to video phone service to better serve deaf or hard of hearing individuals seeking help through the Lifeline of 988. So it says that it's currently in the process of working on that. So you just have to stay tuned to see when it's actually done. All right. So I'm just making sure I don't have any visitors today. I was thinking my daughter might pop in, but maybe not today. Hold on. Let me send her the link. She might come in. Let's see. Give me a second. I'm gonna let me send this link right quick. Okay, I can see. I'll be glad when I get my audience built up. So I have to talk to myself. It's okay for right now. But eventually. Okay, let me send this to her. All right, and let me send it to. Oops. All right. Sorry about that. I had to send out a invite just in case my daughter wanted to come and join me today. All right, so let me go back. So we left off on talking about the services for the hard of hearing and blind. So like we're saying, for right now, just for right now, until they come up with the video phone. For right now, you'll just call 711 and then once you call dial 711, then you will call the 1-800-273-8255. It says, how is it being funded? It says Congress has provided the Department of Health and Human Services workforce funding through the American Rescue Plan, some of which will support the 988 workforce. So if you caught my live from yesterday, um, in that live you will have heard me talking about the American Rescue Plan. So, um, the American Rescue Plan, this is part of the American Rescue Plan. So, also the President's fiscal year 2022 budget request provides additional funding for the Lifeline itself and for other existing federal crisis funding sources. At the state and territorial level, in addition to existing public private sector funding streams, the National Suicide Hotline Destination Act of 2020 allows states to enact new telecommunication fees to help support 988 operations. So basically what that means is they're going to charge your your cell phone bill is going to go up basically. That's exactly what that means. Your cell phone bill is going up. So just in case you didn't realize what the telecommunication fee is about. So we will essentially be paying for this, but they also have a budget for it as well. So hopefully it'll only go up a couple pennies or so that we don't even realize it. Okay, so let me stop sharing this for a second. You guys give me about 2 minutes. I'm gonna turn on the music and I'll be right back. I have someone at my door. Hold on one second. Okay, I'm back. I do apologize for that. So let's get back to it. Let me share my screen. Okay, so let me just make sure you can see this. I guess I can make it a little bigger. All right. Let's see. Okay. So it says, so the last thing we went over is how is it being funded. So it says, are states ready for 988? The National Suicide Prevention Lifeline has been available to all states since its launch in 2005. Basically, that 1 800 number has been in effect since 2005. Regarding the transition to 988, states are at varying degrees of readiness for the volume increases expected from moving to the three-digit code. And that's why SAMH funding to shore up, scale up, and staff up is so critical. So it looks like this place is hiring you guys. SAMHSA.gov is hiring. Sounds like. Okay, so and we're going to go into that about the different states and where they're at. How can states further prepare? This that really has anything to do with the public. That's just gonna um do with the states getting ready. Um, let's see. I'm just trying to find the important questions that actually matter to us, right? The general public. Let's see. Is 988 pulling funds away from 911? So I know this question is important to a lot of people because that I heard a lot of discussion about that when all the tension was going on around maybe a couple years back, and they was talking about defund the police. My understanding of when they were saying that is basically, and I'm just giving you my understanding, and that's all I can give is how I perceive it to be, right? And I do understand everyone has their own understanding of events and they perceive it the way that they perceive it, right? But my understanding is when they were saying defund the police, basically taking, like, when a person is dealing with a active mental health crisis or active substance abuse use crisis or active suicidal thoughts, taking that responsibility away from the police and or from 911 and allowing 911 to deal with public emergency public safety emergencies, right? So which it makes sense because if you have ever caught any of my lives, I said it over and over, not to take any way away, not to take anything away from the enforcement officers, but a lot of times these officers are not equipped to handle active mental health crisis. We just gonna say it like it is. They didn't go to school for it. Because if so, if I could go to school to do what I'm doing now, I might as well did two in one, right? I might as well have been a police and also been a mental health professional. I could have did both of them and and, and not had to go to school for what I'm doing now. So with that being said, it should tell you that it's a distinct line right there. Law enforcement officers are not equipped, and I think that's what more of what it was being said when it was saying when the move to defund the police. It was more about let's take these crises, the mental health, the substance use, and suicide at the suicidal thoughts. Let's take these issues away from the police and create something that's different, where trained professionals are showing up on the scene, and let's let 911 deal law enforcement officers deal with what they were trained for, and let the mental health professionals deal with what they were trained for, right? So let's see what they say here. Sources of federal funding for 988 are separate from support of the 911 system. Additionally, the Hotline Designation Act permits states to apply specific 988 fees to support crisis services in a manner that is distinct from fees used to support 911 operations. The FCC has issued a report specifically on the issue of 911 fee diversion. So you'll probably be seeing that pretty soon. If your state cannot come up with the money to fund the new 988 number, you're probably gonna see a little increase on your cell phone bill. I'm just letting you know that now, just in case you see those extra pennies. It's probably gonna be, you probably won't even notice it because if you're taking like what, a dollar, additional dollar and just say you got what, let me just take a guess. Um let's just say let's just say 30,000 people in your city, and you raise the cell phone bill up $1 to fund the 988. That's what, $30,000, right? And 30,000 people, that's kind of small for a city, especially a big city. So, I don't think you would notice the fee, but it might be coming if your state or city cannot find a way to fund the new 988 number. Just want to make you aware of that. Okay, let's see. So it says, is any of the SAMHSA funding to states going to address equity, equity? Well, I can't say the word today. Diversity. As a component of SAMHSA's funding, states and territories are required to address strategies for populations at higher risk of suicide, many of whom are communities of color and historically marginalized groups, including plans for how they will measure effectiveness and improving outcomes and access to service across populations. So basically, they are this with this new program. The funding requires SAMHSA to address strategies. So they're going to have to have a strategy for addressing the risk of suicide in these communities of color and historically marginalized groups. And also, they will have to come up with so it will have to be proven that they are improving the outcomes in these populations. So they cannot just say it, yes, it's working. There is going to have to be something that can be measured to show that yes, it has been an improvement in these populations. Okay. All right. All right, so let's go ahead. Would that be a national campaign to advertise 988 to the public? Well, first of all, I'm doing my part, right? I don't know how many I'm reaching, but hey, if I just reach one person and that one person tells the next person, that person tells the next person, right? The word starts to get out. But let's see if it's a national campaign. In the coming months, SAMS In the coming months, SAMHSA will provide additional resources for 988 partners to use when communicating about 988 to their audiences, such as content and graphics for, excuse me, social and digital sharing. It's HHS is working with Congress to ensure federal resources for a national campaign to advertise or promote awareness of 988 to the public. And given 988 will not be available to everyone across the country until July the 16th, 2022, which is here now, it came very quickly. SAMHSA recommends not promoting the use of 988 to the public until that time. So, okay, so you read that, but I just want to make you aware of it now so you can write it now and you'll have it. You cannot use it until July the 16th. So you'll probably start hearing a lot about this as the time comes up, right? Because they said they don't really want to talk about it too much until it has been rolled out. But if you think about it, and I'm pretty sure this, let's see when this came out, just so we can have some type of time frame. Okay, it doesn't have a date. All right. So Um, I'm giving you the information earlier because if you think about it, that's only a month, and that's what, a month and 8 days away. So sorry, y'all. I said this is a week before my birthday, so I was trying to calculate my birthday at the same time, which means my birthday is a month and 2 weeks away. Okay, all right. So that's only a month and 8 days away. And we all know how quickly time flies. So I just suggest you have the number, but if you write down the number, I would suggest you write down the 1-800 number as well. This is the number that is currently still in use. This number, the 1-800-273-8255, but you would want to put 988 and beside it put you can write begins July the 16th, 2022. But until then, you can use the number you already have. But if you're having a mental health crisis or substance use crisis, or just need emotional support, don't call 911. You don't need to call 911. Don't call them. Just call them if you think you are about to become a victim of a crime or something, or you having like physical issues and need to go to the emergency room. Okay, that's fine. But if you have mental health issues, substance use issues, emotional need emotional support, do not call 911. They're not equipped to handle that. And I'm just gonna tell it like it is. Call this number or go on this website. Now, if you need 911, because you're a victim of a crime, of course, call them ASAP. I know I'm going to call. Or you need to go to the hospital, call 911. This number won't help you. But if you're, once again, mental health issues, substance use, uh, active crisis, what else? What else did I mention? Or needing emotional support, call the 1-800-273-8255. And July 22nd, 2022, you can begin to call the new number. They will assist you. And the best part about the new number, the 988, is that it's not just a call center. It's just not like a call. You'll call them and say, I'm having these thoughts or whatever. So once you have that conversation, you're gonna get assessed, right? And then from there, they're gonna supply you with resources in your community. So this is not just like a hotline that you call and someone is going to talk you out of attempt to talk you out of whatever is going on with you. You're going to also receive more assistance. You're going to be assessed to whatever all that you need. You know what I mean? Okay. So, let's see. Let's see. And like I said, I'm just reading the things that I think the general public needs to know. I'm not gonna go into the other information. Okay, this would be something you might want to know. Is 988 Lifeline really a free service? Yes. The Lifeline responds 24/7 to calls. And like I mentioned earlier, they do have multiple languages, chats or texts. But just keep in mind, if you are testing 988, um, keep in mind it's going to be English only. So if you have that language barrier or you feel comfortable in talking in a language more comfortable talking and speaking in a language other than English, you might want to call the number, and it's available 24/7, and you can chat as well. But if you text, you can only do English. So it says, so it is free, and it will connect you to trained crisis counselors. The support and service received from the crisis counselors is provided at no charge to those who use the service. However, standard data rates from telecommunication mobile carriers may apply to those who text to the Lifeline. And most of the times when you use your number for something, you're gonna see this last sentence. So, most of the time, I'm not gonna say most, but I know lots of people have like unlimited service, so it wouldn't really apply. But if you had just like if your phone was based on minutes, you might want to, and that you would probably use, well, I'm trying to say this carefully. So if your phone was minutes and you know that this possibly may be a service that you may possibly need in the future, you might want to just make sure you won't be charged for using it, because as you see the last sentence, however, standard data rates from telecommunication mobile carriers may apply to those who text to the Lifeline. Okay. 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 So it says, what type of training do Lifeline crisis counselors receive? The Lifeline currently requires that all network centers adhere to specific standards regarding suicide risk assessment and imminent risk interventions. However, each crisis center also develops their own specific training to meet organizational needs. The Lifeline core clinical training, wow, why was those words so hard to get out? Currently under development will be a self-paced online training that will cover essential skills for crisis counselors who answer calls, chats, texts within a Lifeline network. Additional training is being developed to address the specific needs of populations at higher risk of suicide. Okay, so we finally got through that one. Let me stop sharing this. Stop sharing this, but I need to come back. All right. So that was a lot. But informational, right? So even though you may not have caught the first beginning, if you did not, I would ask that you go back, right? And check that out. I just gave a whole lot of information about the 988, the new 988 number, which will be available July 16, 2022. And it will so instead of calling 911, if your loved one or if you or your loved one were experiencing mental health crisis, substance use crisis, or just needed that emotional support, instead of calling 911, which was our only option in the past, right? Because I know most people do not know the Lifeline number. They just call 911. You're going to call 988, okay? Just catching anyone up who's just joining in. All right, so we're done with that. I can add out of that. What is this? All right, this is Jonas 7, and this is okay. All right, so we're going to briefly go to this next bit of information. So I want to show you this. This is from 2021. I want to start with this, and then I'm going to take you to an article that was published yesterday. So this is basically like a year difference, and you just tell me what you think out there hearing both of the articles. All right. So let me go here. Let me make sure. Let me make it a little bigger. Let me see. That should be big. I might can make it a little bigger. Okay, that should be huge. It might be too big for me to read it. Let's see. Okay. All right. So like I did state, this is the article. It was dated July the 16th. So this was approximately a year before the 988 number was scheduled to drop. So this should be speaking on the aspects that, okay, we still have a year left. All right. This is from the kennedyforum.org. Like I said, it's from July 16, 2021. The title, Countdown. States have 1 year to facilitate 988, the nation's first mental health crisis line. All right. So let me see if it has I don't see an author. So it says 47 states haven't passed legislation to support the new line by the July 16, 2022 deadline set by Congress. 47 state you got. Are they taking it serious or what? So I'm not going to read this whole article, right? Because I've been here over an hour already. So, and I still have one more bit of information I need to present. So I'm just going to kind of go through what I deem important to share with with my audience. Let's see. So we'll start right here. A new, and then if you wanted to, you see the if you look at my browser, let me see. Can you see my browser here? No. Hold on. Let me see. Can I bring it down right quick? Let me bring it up, brother. Oh, you're not gonna be able to see it. Okay, so if you go to the kennedyforum.org, this article is there. Or you can always reach out to me, and then I can get you the information as well. And we can have a discussion about it. You can get more information wherever you want to go with it. All right, so let's go back to the article. Um, A new analysis by the Kennedy Forum shows only 3 states have passed adequate legislation to facilitate 988, the nation's first 3-digit number for people experiencing mental health crisis. Last year, Congress unanimously oh, my tongue. Passed a bipartisan National Suicide Hotline Designation Act of 2020, which created 988 as the universal number for the National Suicide Prevention and Mental Health Crisis Hotline as an alternative to 911. So I know you all have heard me say that, and I'm not sure if you believe me or not, but you see it right here, right? But not exclusively alternative. I mean, not as so it's not replacing 911, right? But as you see, it's for those active suicidal thoughts. I can't say this enough because I know somebody will come and look at this and what does she mean? So I just want to make sure I'm making my point when I say you're calling 988 beginning July 16, 2022, when you or a loved one, right, are having or experiencing an active mental health crisis, active substance use crisis, emotional support, like, you just need some extra assistance right now. And it's like 2 o'clock in the morning, right? Because it's open 24/7. So this is not to replace 911. You would still call 911 if your life is feeling threatened, right? If you need to go to the hospital and you can't make it, uh if someone is trying to break in your car, stuff like that, yes, because that's what 911 is for. 911 was not created to handle mental health needs, much less crisis. All right, now that we got that out of the way. Okay, so it says, so we left off at as an alternative to 911. However, most states are behind. This was a year ago. However, most states are behind in advancing critical legislation to fund their local 988 infrastructure. Congress mandated a deadline of July 16th, 2022 for 988 to be available nationwide. The deadline is exactly 1 year away, and states are running out of time to fund and implement important components of the system. So are here's going to be the important components of the 988 system. So it's supposed to have 24/7 call centers staffed by mental health professionals. So that's one part. The mobile response teams, which we did discuss yesterday. So you should know a lot about those. So that and crisis stabilization services that connect people to follow up care. So you would the crisis. So the crisis stabilization is basically you're gonna be stabilized because right now you're in crisis. So if you're in crisis, the goal is to get you stabilized, as quick as possible. But however, still being treated with dignity, still providing at least restrictive care, right? Just still trying to keep in mind the Community Mental Health Act of 1963. That's a plug. So if you want to know what it is, go look on my YouTube channel. I have a part one and part two. But basically, just continue to treat these individuals with respect and dignity that I feel that 98% of humans deserve. All right, but because if you call 911, they don't have time for all of that. They're here to stabilize the scene, but not the type of stabilize that how a mental health professional looks at it. There stabilizes two different definitions, right? Right? All right. I don't think I need to go much more into that because we know that. All right. So these are the components that consist of a when calling 988. And a lot of states have not do not have this in place. So you're supposed to have the 24/7 call center that's staffed with mental health professionals, which let me just say there's already a shortage of mental health professionals, but these call centers are supposed to be staffed 24/7. So that's going to be interesting. Mobile response teams, we did discuss the mobile response teams yesterday. So I'm not going to go much into that. I have a whole live on it. And crisis stabilization services. And I think I'm going to talk more about crisis stabilization services. Am I very busy tomorrow? Hold on one second. I'm just looking at my calendar. Okay, so I might not be able to go live tomorrow. Oh, I might. Okay, so yeah, I'll probably do it. But whenever my next live, I'm going to talk more about crisis stabilization because I know I have mentioned that word quite a few times and it does go along with the components for 988. So I just want to make sure you have more information about what that details. Okay. Too often, when individuals experience a mental health crisis need help, they are met by law enforcement, resulting in unnecessary incarceration, trauma, or even worse. Between one quarter to half, so they're being modest when they say one quarter, but then they admit the truth to one half, and it's probably higher than that, of all fatal law enforcement encounters involve individuals with a serious mental illness. So that's between one quarter, right? So you have one quarter and half, between one quarter. Okay, so between one quarter and half. So that means so they've been modest when they say one quarter. But we being honest, we're gonna say half, right? That means half of individuals being pulled over by law enforcement have some type of serious mental illness. And I just want you to let that sink in. It might have didn't sink in as I was saying it, but I just want you to give your brain a couple seconds to let that sink in. Okay. People with untreated mental illness are 16 times more likely to be killed during a police encounter than other civilians. And Black Americans are nearly 2.5 times more likely to be killed than white Americans, and Latinos are also disproportionately killed. And this is from the kennedyforum.org. So these are not my words, but I'm pretty sure if it wouldn't take much research to find this information. Okay, so this making a 988 number even more important, you guys. All right. This 988 number, you don't have to call 911. You don't have to risk law enforcement officer coming out on a scene and not recognizing that a person is having an active mental health crisis. All right. Relying on police to respond to mental health emergencies also requires tremendous local resources. In 2017, an average of 10% of law enforcement agencies' total budgets and 21% of staff time were spent responding to and transporting people with mental illness. Even before the pandemic, our country was in the midst of a mental health crisis with suicide and overdose rates at historic levels, said former U.S. Rep and founder of the Kennedy Forum, Patrick J. Kennedy. P- Police were never meant or adequately trained to deal with mental health emergencies. So this just confirms everything I've been saying if you've been listening to my live. And I'm going to leave it at that. This antiquated approach to emergency response hurts everyone, individuals with mental health and substance use disorders, their families, and entire communities. 988 will be critical to managing an anticipated significant increase in call volume due to the pandemic, preventing deaths, and stopping the criminalization. I told you, man, it's tongue of mine. uh, Mental illness. To fund this overhaul, Congress authorized states to pass user fees on telephone lines, the same source used to fund 911. Yet few states have acted, putting their local 988 systems. Oh man, I'm gonna have to edit that out. So putting their local 988 systems at risk. So, we did discuss that a few minutes ago, where you might see a few couple dollars come out of your cell phone bill. So it says below is a summary of state 988 activity to date. So these are just the states that have actually did something something to try to comply with the new 988 number, which will be available July 16th, 2022. So it says Colorado, Nevada, and Washington passed strong legislation with user fees to fund the 988 system. Okay, so at least they did something. At least they have started to collect the money, because if you as I stated earlier, in some states they have been giving the go ahead to tax cell phone bills to fund the new 988 number, just like we pay for the 911 number, which makes sense. If we giving a dollar or two, or however much we have to pay for 911, it only makes sense to give those same couple, I mean, not the same, but also additionally give a dollar to the mental health line as well. It only makes sense. All right. So that's Colorado, Nevada, and Washington. So they have began to charge the funds that's going to come from your cell phone bill. Okay, so the next one we have California, Kentucky, New Jersey, and Massachusetts. They have legislation pending. And this was a year ago, so we don't know for sure. Like, for example, we don't know if Colorado, Nevada, and Washington has actually, even though they passed the legislation, we don't know if they have began to uh, collect these funds, because this was a year ago. And then California, Kentucky, and New Jersey, and Massachusetts have the legislation pending. So we don't know if this is passed, if it failed, because this was a year ago. And then, like I always say, if you're keeping up with me in this live, that means um, you're down to do some research, right? Because like my sister told me, she I asked her, did she watch my live? She's like, yeah, but it's why she do me this way? She said it's kind of boring, right? But it's educational. So basically what she's telling me, yeah, it's gonna be boring in some people, but the people who love this type of information don't have to really go research. It's right here in front of your face, and it's informational. So some people are going to really enjoy this. So basically that's what she was telling me, or at least that's how I take it. So hey, we good. So with that being said, I would encourage you to go to the kennedyforum.org. Maybe that's where you could start. And then just, well, you can start here, but just do some research and see, has Colorado, Nevada, and Washington, have they started collecting these fees? We can go to California, Kentucky, New Jersey, and Massachusetts and see, did the legislation is it still pending? Did it pass? Did it fail? Because if you're here on my channel, I'm going to always encourage you to take it a step further and do additional research, because that's how we learn. That's how we expand our brain power and all those good things. And it also, if you, it also distracts your mind if you need some type of distraction. All right, so here we go. Virginia passed legislation, but with limited user fees that will not fund vital system components. So that to me didn't make much sense. Why go? And these are my words. This is my opinion. So I don't know how big my channel will get, but just in case this gets big and a lot of eyes start seeing this, this is my opinion, and I have the right to my opinion. This is strictly for informational purposes, education purposes, and research purposes, and that's it. I don't own any of this information. Anything that I speak is my own opinion. If it comes on my panel and speaks, it's their opinion. So with that being said, let me finish my opinion. So it says Virginia passed a legislation that would limit user fees that will not fund vital system components. Why didn't you just ensure that it would fund it? Why pass legislation? Go out your way, do all that extra work. Well, not extra work, but do all that work just to pass something that's not going to even cover it. Like, was that on purpose? What was okay? But anywho's, let's keep on. I don't understand that. Why pass it? Why go out your way to pass it, but you know it's not going to be enough money to fund even the vital system components, much less the rest of it. So that doesn't make much sense to me at all. Hold on, you guys. Let me put my website on here. You gotta advertise for yourself. Let's see. Hold on. Let me go back. So this is getting interesting. It says Utah, Illinois, and Indiana passed legislation with no user fees. Okay, so they deserve a hand clap because they passed it, and they didn't tax any additional money. They just did what they're supposed to do. They didn't put it on a taxpayer. They said, okay, we need this to be a part of our our is it infrastructure? Maybe that's the wrong word. But we need this to be part. We believe in this basically, because that's basically what they're saying. If they're not putting any additional user fees onto the people, right? So that's basically what they're saying, because the reason I say that is because they were given permission to charge user fees. So if a state is not, they was given permission when the plan was passed, the American Rescue Plan was passed to charge these additional user fees. So if a state does not charge the user fees, to me, they definitely deserve a hand clap. All right. Let's see what Texas talking about. My state I used to live in. I love Texas. All right. Okay. So we're gonna say Nebraska, Texas, Alabama, New York, and Oregon passed legislation without user fees, but so they did do it without user fees, but created studies, exploratory commissions, though Oregon allocated some state dollars in your user fees. So basically, what they're saying, they did so Nebraska, Texas, Alabama, New York, and Oregon. Or so your cell phone bill will not go up. They didn't charge you any fees, but they created studies or exploratory commissions. And I don't exactly know what that means. I would have to do further research on that, or you could do it. But that's so that's just the second part of it. So they didn't charge user fees, but they did create these studies. or exploratory commissions. But Oregon, they didn't charge user fees, but what they did, they just took it out some they allocated some state dollars in lieu of user fees. Okay. All right, so let's go. And it says 34 other states and the District of Columbia have taken no steps to advance 988. So these states you see here, even though some of them, like Colorado, Nevada, and Washington, they passed strong legislation to fund with user fees to fund the 988 system. California, Kentucky, New Jersey, Massachusetts. Um, and like I said, this is a year ago, so I don't know if this legislation has passed as of yet, because as of July the 16th, 2021, it was still pending. But they definitely, this is what they're doing. They're intending to charge user fees as well. And if you recall, that these user fees will uh, result in increasing your cell phone bill, which it shouldn't be much. It will be just like if you look on your cell phone bill, and however much you pay for 911, it's probably going to be same plus or minus. It's going to be somewhere around there. So, and I'm pretty sure you don't even recognize the 911 charge coming out of your phone bill. And if you do, I'm pretty sure you don't mind. So you shouldn't mind about the 988 either. uh a little fun coming out. But my point right here for pointing these out is you could literally do this without any user fees, because you see states here that won't be doing user fees. And then I don't know what to say about Virginia. They passed legislation. Why would you pass it? But you, if you're gonna charge the user fees, right? If you're gonna go ahead and charge it, at least charge the people enough so that it's gonna cover what it needs to cover. But it says it won't even fund the vital system components of it. So, but hey, what do I know? Okay, and then so that's user fee versus charging no user fee. However, it's 34 states that's not even, they haven't did anything. 34 states. And this is a number that's supposed to be out July 16th, 2022. Okay, so because here it goes right here. Despite the clear intent of Congress for states to fund local 988 systems through small fees and telecommunications bill, so it only, I said $1. Shoot, it's only gonna be like less than 50 cents per phone line per month to be paid by customers. So per phone line, okay, it's only 50 cents. I thought it was gonna be more like $1. So it says, despite the clear intent of Congress for states to fund local 988 systems through small fees and telecommunication bills, large telecom companies have objected. Success, oh, because they have to go through the, oh, I didn't think about that. They have to go through the cell phone companies, I'm assuming, and asking them to add it. I'm assuming, since it says large telecom companies have objected. But my thing is, what salesperson, I guess that's the name you want to use, did you send to the telecom companies? Because it only makes sense for you to do this, just like you allow 911 to be taken out of phone bill. Why not allow 988 to be taken out the phone bill as well? Especially when it's only like 50 cents, you know, just like you allow now 50 cents or whatever the amount is that's taken out your bill every month, taken out of a person's bill every month. You allow 911, I mean, yes, 911 to the 911 fund to be taken out, or 911 to fund 911. It's taken out your cell phone. But you have large telecom companies have objected to I'm assuming, I would have to do more research on this. I'm just now reading about this, to take out the fee for 988, which is dealing with mental health. So you have alternative to calling 911. That's so weird to me. But successfully scaling back legislation in states, including Nebraska and Virginia continue to fight legislation in other states. So now it's making sense. The reason that Virginia has this, what you remember me mentioning Virginia, and I kind of got a little loud when talking about Virginia because I was saying they passed a legislation, but with limited user fees that would not fund vital system components. Okay, keep that part in mind, right? So when I first read that, it got me a little heated, but now it makes sense because I come back down here, um, and it says large telecom companies have objected and successfully scaling back legislation in states including Nebraska and Virginia, and continuing to fight legislation in other states. So that's why Virginia, even though they went ahead and passed it, they had to pass it this way because of the large telecom companies. It didn't have to do with Virginia per se. It had to do with the telecom companies not agreeing to charge the amount. Woo, child. All right, let's see. Okay, so I'm here. Like I said, I'm not gonna be sharing all of this. I'm just going to share what I think the public needs to know. Okay, so let me just read this. This is a story from this is a story about Miles Hall. He was a 23-year-old black man who lived in Walnut Creek, California, and suffered from schizoaffective disorder. Even though his mother, Twan Hall, had proactively reached out to police to explain Miles' condition and warn them of his sometimes erratic behavior, the unthinkable happened after neighbors called 911. When police responded to our son's mental health crisis, they shot and killed him within moments of arriving, said Hall. Trying to solve a public health crisis with a response from law enforcement has proven to be ineffective and deadly. 988 is a critical step towards decriminalizing mental illness. It could have saved our son's life. It says constituents in states that have no 988 legislation in the works can contact their state representatives and ask them to introduce a pass a bill that includes 988 user fees. They can also contact their congressional representatives to ask them to support the state's response. So this is going to come another time when I want you to do further research, because it says if your state, and I'm gonna show, uh, maybe you might have to do that on your own. I'm not sure. Let's see. So it says states that have no 988 legislation in the works, you can contact your state representative and ask them to introduce that bill to include 988 user fees so that the 988 number can be, it can be funded in your area. So if so you don't have so no one will have to worry about that the 988 did not include the main components, the vital components, right? Which is that 24/7 call center that includes trained mental health professionals. Then you have the mobile crisis team, and then also crisis stabilization. So basically, if you were paying those 988 user fees, your state or city or however you want to break it down, it would ensure that, well, I guess I would say your state, it would ensure that your state would be funded to for to include these vital components. Okay. Okay. So that is that. Okay, so we're coming to an end. Let me stop sharing this. All right. So the last little bit of information. I think this is June 7. Which one is this? Okay, so now, so just keep in mind the information I just shared with you. It was from a year ago, right? That was the year old information. It was exactly July 16th, 2021. So what I'm going to share with you now is an article that came out yesterday. So this is the update. And remember, we have what, 1 month and let's see, we have 1 month and today is the 8th. So the 8th, we have 1 month and 8 days to go before 988 is to unroll in all states and territories. So we're gonna come with that. But first, I am a therapist and I always believe in, okay, let's take a 5 minute break. So I'll be back at 5, and because we've been here like for almost fast. So I'm gonna take a break. Go get you something to drink, whatever you need. Just get it done in 5 minutes, and we'll be right back. All right. Let me turn the music on for your listening pleasure. Okay, I'm back. I'm back. I hope everyone enjoyed their break. All right, so let's get back to it. I'm almost done with my content. I hope you enjoying it so far. All right, let's see. Where was I? Okay, so like I said, what I'm about to present now is we just read. Well, let me go back. Previously, before we went on break, we were talking about an article that was from July 16, 2021, talking about the only states that have begun to implement the 988 number. So now we're going to go to an article that came out today. All right. So this just came out yesterday. And I don't know why it was such a big deal yesterday, but I saw a few articles being released yesterday about, the 988 number. Okay, so let's start with this. Let's start with this. All right. So I think it's okay. So if you have not news break, you probably saw this already, but I love news break. It keeps me oh let me go here. It keeps me updated on all the and this is from the Hill. This who sent me this. But anywho's it's a nice article. Okay, so this is it says Maryland State up here. It's from Shireen Ali. Like I did say, it was released yesterday, so this is gonna be current information. The title states most states appear unprepared for National Suicide Hotline 988 to take effect. So in order for us to fully engage in this, I'm just going to need you to remember all the information that I have shared so far. And now we're up to current times and let's see what it says together. Okay, so it says, um, story at a glance. The National Suicide Hotline Designation Act made 988 the new National Suicide Hotline number, able to receive phone calls and text messages. Eight by imposing phone fees, but only 13 have enacted legislation that addresses funding the new hotline. So I hope I didn't X out it. Oh, I already X'd out of it because I wanted to go back to see exactly how many states that was at first. I think it was three, six, three up there. It might have been about nine. I'm thinking somewhere around there, and I could be wrong, but if my memory serves me right, I think it was about nine, which was July 16, 2021. So let's see have what we have now. And it just told me rain is coming. Let me see when is rain coming. That's my city on there. So it says Illinois, Arizona, Connecticut, Iowa, and Maryland are among those states not introduce any legislation that addresses the 988 hotline. And recall now, this is supposed to go out in a month and 8 days. The U.S. is weeks away from launching a three-digit national suicide prevention hotline that will be able to receive phone calls and text messages, but most states are unprepared for the rollout. And before I go any further, and like I said, I don't know exactly how many people this live will get to, but hey, if you're looking for, if you're giving out grants to let me just do my plug. Leave me alone, you guys. If you're looking for someone to get the word out about this 988, like if you're giving out grants, my company would gladly, let me put my company out here while I do this quick plug. So if you're looking for companies to, to advertise or do the promotion, uh, please reach out to me, Duvalier Consulting Services.com. I'm doing it already. So, hey, why not make a partnership out of it, right? All right. So let's keep going. It says most states are not ready for this rollout. Starting on July the 16th, anyone can call or text 988 in order to access the U.S. suicide hotline. It's an initiative that began under former President Trump when a National Suicide Hotline Designation Act was signed into law. It requires every state to implement the necessary telecommunication systems to enable phone calls and text messages to 988. And after I get out this live, I'm gonna also have to do more research because I'm starting to hear this National Suicide Hotline Destination Act. This is what 988 is falling under. But if I recall, when I was doing my information yesterday, I did read something about what was it? It was called goodness, I just had it on my head. Oh, American Rescue Plan. So I don't know how closely those are related. I will need to do more research because only today I'm hearing more about that it's under the National Suicide Hotline Destination Act. So I will, because I only want to bring valid information and unless I'm giving my opinion, and you will know. Um, it says the law aimed to establish a shorter, universal phone number for people to access suicide prevention support. However, most states don't seem prepared to launch 988, with only 13 having enacted legislation that directly addresses implementing and funding the new hotline. And this is according to National Academy of State Health Policy. So if you wanted to do more research, here is your website, National Academy of State Health Policy. It says Washington State is among those ahead of the game in acting legislation last year that added 24 cents per line to residents' monthly phone bill in order to fund 988. The fee is expected to bring in about 46 million annually to cover most of the cost of expanding the state's suicide call center. So this is a prime example. You see, it's 24 cents. I'm pretty sure no one is going to miss 24 cents, right? To fund a state suicide call center, just like they pay the little cents to fund 911. So they are ahead of the game. They're ready. Washington State is ready. They ready. They charging the 20. They passed the legislation. Enacted the legislation last year, added the 24 cent, and they're gonna bring in $46 million. So I was way off earlier when I said 30,000. They're gonna bring in $46 million annually just by charging 24 cents. It's not hard. If the states want to do it, it don't seem that hard. So let's see what California. I recall California being on the previous content that I read. California has introduced legislation that takes a similar approach. So California is adding 80 cents per month to phone line bills in the state. However, the bill is still working its way through the state Senate. Illinois, Arizona, Connecticut, Iowa, Maryland, and many more states have not introduced any legislation that addresses 988 despite a federal mandate. So this is a federal mandate, but these states have not did anything. Um, the U.S. Department of Health and Human Services tried to jumpstart the 988 initiative by introducing a $177 million fund to strengthen and expand the existing hotline network operations and telephone infrastructure. An additional $105 million was earmarked to help states increase necessary staffing across the crisis. This money, so they introduced $177 million fund, and also additional $105 million fund. So I don't know what the issue is. However, a report by the SAMHSA, right, it estimated the 988 hotline will require a continued partnership between federal agencies and states. Though SAMHSA offers state grants to fund their local 988 hotline efforts. So this just answered my question about the grants. Most local crisis centers receive only $2,500 to $5,000 per year to support calls, texts, and chats, and many rely on unpaid staff to manage demands. Oh, no wonder. In order to help states support 988, Trump's Destination Act authorized states to impose cell phone fees, though with just weeks left until the new three-digit hotline goes live. Most have yet to do so. It says the estimated average cost per contact is $82 for a 988 call center. So that's it. So I'm done with that one. And let me just go ahead to the next piece of information I have so we can get out of here. We've been here for a while. Let's see. All right. Share screen. That is this. So this came out yesterday as well. So this is about a little more about the 988 number, and this came out yesterday, just as well as the other article that I just read. All right, so let's get a little bigger. So it says, the new national hotline for mental health. How will we pay? This is on NBCnews.com and to find the article. Fewer than half of the states have enacted legislation to pay for the 988 suicide prevention number set in July. And I'm not going to go, I'm just going to go through and see if it's any additional information other than what we just read. Erica Edwards, Emily O, and Kate Snow. It was written yesterday, June 7th, 2022. This is not my writing right here. Informational education only. You can see mine this on my YouTube video. So well as all the other videos that are on my YouTube channel. So so I'm just gonna just quickly just because and just see if there's anything in here that we haven't already read. It says most states, including South Carolina, have not allocated money for the service. Even partial legislation to implement 988 is pending in only 20 states, according to the National Alliance on Mental Illness. Just four states, Colorado, Nevada, Virginia, and Washington, have enacted comprehensive funding plans. So as of now, like most states, including South Carolina, they don't have any money for the service. They haven't tried to pass a legislation to say, okay, we're going to tax the cell phone bills. Put on additional fee on the cell phone bills. They haven't did anything. So in only four states, Colorado, Nevada, Virginia, and Washington, have enacted that comprehensive funding plan. Uh, so it says, according to a Rand Court report published last week, more than half of public health officials charged with launching the 988 line said they felt unprepared and without necessary financing for staffing or infrastructure to handle the rollout. All right. So I guess they just feeling overwhelmed. That's what I'm getting from it. She say some states have enacted legislation to add a fee to cell phone lines to pay for 988, but similar proposals in many states have failed. Okay. So it says these people above here, they received the grant. So I want to just go into the grant. I just want to read what the Piver says. It says, we have an infinite amount of resources to help people work remotely, Piver said, but there's no new support, she said, to hire enough qualified people to staff the lines. Calls that come into call centers without appropriate staffing are put into a queue and routed elsewhere, often to the National Support Suicide Hotline or to other states. if we don't have the folks to answer the phone, time is an issue, she said. People in mental health emergencies who are strong enough to call for help need help quickly. Are they going to stay on the phone that long to make sure they get routed to someone else? The minutes do matter. And that's going to be the thing, too, because, like I stated earlier, it's already a shortage of mental health professionals. So it's going to be interesting to see how will they find a staff to I mean how will they find a personnel to staff these call centers, because they do have to be trained mental health professionals. So let's see. Waiting for help makes callers in crisis less likely to call next time they're having a problem, Cyril said. If they're in a crisis where they're suicidal or thinking of ending their life, it could lead them to hang up the phone and attempt suicide or die by suicide. We already know what is 988. We already went over that information. Um, so that's about it on that. We already went over all the other information. So I'm just going to give you my take and then I'm going to end the live. So my take is the 988, the implementation of the 988 number as an alternative to calling 911 when one is when one is having an active mental health crisis, substance use crisis, or, just needing that extra emotional support. Um, which will go into effect July 16, 2022. So it sounds like it is a good idea. It's a great idea. It sounds good. It's promising for the future. But my question is, being a therapist, right? Being a mental health professional, um, what would get me is that there's already a shortage of mental health professionals. So I don't. I guess my question would be, how are they gonna? How will they? How will they staff these call centers that have to have people in there 24/7? So are they gonna offer more than the market? Because that's the only way I see that they would be able to, have, these call center staff. Like, are you're gonna have to offer more than the market? That's the only way I see people, dropping what they're doing in droves and coming, and I'm just being honest, because there is a shortage of therapists. So we have to be true. We have to bring that to the table and be truthful about that as well. So that's my take on the whole scenario. So we still have a month and 8 days left to see exactly what's going to happen. They have until July 16th to roll out with this new number. It's a federal mandate, so it is required by all states. But as we read, I think it's only like 4 states that have actually pass a legislation in order to get it funded. So we just will have to wait and see. But as time, I'll probably just wait until July 16th and do a live on the actual date it comes out. I think that'll be cool. I think I should be available. Yeah, so I'll probably just do an actual live on that day or maybe the day after, just to, see exactly how many states complied with this federal mandate. But thank you all for being here with me. If you stayed to the end, I know this was a longer live than usual. I just had so much information and then the time passed by so quickly. So thank you for being here. I ask that you please just continue to tune in. Like I said, like I said earlier, my name is Lily Duvet, your favorite therapist, Lily Duvet. I talk all things mental health over here. A lot when I'm reading the articles, as you can see, they are not my articles, but I present it to my community, to the community, as a way of providing education, um, research purposes, and also just entertainment as well. Not saying that this is an entertaining subject, but every now and then I might tell a joke or two, just to just try to throw a little joke in there every now and then, but not. This is not a joking matter. So if I'm telling a joke, it's gonna be totally unrelated to this specific topic. Just so you know that. All right. So with that being said, I hope you all enjoyed, and I'll see you the next time I go live. Okay. Bye bye.